Well, obviously now you can get instant answers to your questions. And I think that's so important for physicians and others who are out in a more rural setting where you might not have the number of colleagues that you could discuss issues with, but you ask a question and the answer is instantaneously brought back to you for the benefit to you, but more importantly for the benefit of the patient.
Through AHEC, we have access to the Carpenter Library at Wake Forest. Nowadays, most all of our journals, textbooks, things like that are all online, so it's nice to have access to those up-to-date resources so you don't have to keep your own separate library.
I think 4 or 5 years ago now, the folks at AHEC supported a wonderful upgrade to our audiovisual recording system in our family medicine clinic. So we have the ability, with consent from the patient, to give the learner, either the student or the resident, the autonomy to be in the room with the patient doing their doctoring and be able to see and hear what's going on, and then we can interact and teach with them having directly observed what was going on. And at times, again with the consent of the patient, we'll record things, and that's a wonderful teaching tool. If anyone's ever seen themselves shoot a basket or swing a tennis racket or something like that, you learn quite a bit from watching yourself in action.
It was always very heartwarming to walk by the library and you'd see physicians and nurses and others pulling books off the shelf, doing some research, but having conversation, educating each other. Now you walk by the facilities and you see dozens of people at computer terminals, which is fine. And what that tells me is Northwest AHEC has seen evolution and has embraced evolution to the most effective and highest quality means to continue this process of providing background resource services for students and for current practitioners.
Northwest AHEC has been a major factor in the library services here at Wilkes Regional Medical Center. They actually, the AHEC librarian came and helped us decide which books to use and get our first library established. And then of course the AHEC librarians are instrumental in journal searches, literature searches. If we have questions about a search or we need information, they are really on Johnny on the spot. They're right there getting us the information that we need. The digital library has a resource called Up to Date, which is very helpful when especially the physicians are asking for information. And the nursing staff, of course, can always access information by going onto the digital library and looking in journals so that they can get current information from that. Or, they can ask for a literature search, or they can do one themselves, or we can do that for them. Well, I just have to say the AHEC librarians are just so wonderful.
To drive towards more continuing education, learn more, be better tomorrow than what you are today. And I think the genesis of all that is the AHEC program. And I think Wake Forest, Northwest AHEC has done it the right way. They share what they have, but then they also encourage you on a local basis to bring forth the talent and skills that you may have locally.